This is an educational video about diabetes type 2. This video is made in simple language so that non-medical individuals can understand about diabetes. In this diagram, this is chest, this is abdomen, and in the abdomen on the right upper quadrant we have liver, and this is stomach, and underneath the stomach this is pancreas. We all eat carbohydrates and sugars, and carbohydrates and sugars go into the stomach and get converted into glucose, and this glucose from the stomach will be absorbed into the blood vessels, and then glucose will be circulated in the blood. When glucose is circulating in blood, then insulin will be secreted by the pancreas. This pancreas has beta cells which secrete insulin, and this insulin acts on most cells of the body. These are all cells, and in response these cells pick glucose from the blood. As these cells pick glucose from the blood, normal glucose values will be maintained in the blood, and this mechanism happens all over the body. Now, logically speaking, if there is decreased insulin secretion, or if the cells does not respond to the available insulin, then there will be diabetes. So, what are the causes of diabetes type 2? Genetics plays a role in diabetes. If one parent of an individual has diabetes, then there is high risk of diabetes for that individual. If both parents are diabetics, then the risk goes up. And then obesity plays a major role in diabetes type 2. If body mass index BMI is greater than or equal to 30, then it can be considered as obesity. BMI, which is body mass index, can be calculated through BMI calculators available on internet. So, how obesity can cause diabetes? In obesity, these cells does not respond to insulin. So, cells does not pick up glucose from the blood, and glucose in the blood is elevated. This is diabetes. This is called insulin resistance. This phenomenon of cells not responding to the available insulin is called insulin resistance. That's what happens in obesity. Initially, beta cells in pancreas think that there is not enough insulin in the body, that is why glucose is high, so they keep on secreting more and more insulin, but cells does not respond to it, and eventually beta cells fail and there will be decreased insulin secretion. This is how, in simple terms, obesity can cause diabetes. So, the higher the BMI, the higher the risk of diabetes. Normal BMI is between 18.5 to 24.9, so it's better to keep the BMI as normal as possible to decrease the risk of diabetes. Studies have shown that waist circumference is also associated with diabetes. In men, if the waist circumference is greater than 40 inches, then there is a higher risk of diabetes. In women, if the waist circumference is greater than 35 inches, then there is higher risk of diabetes. The diabetes prevention program showed that regular physical activity decreases the risk of diabetes. So, low physical activity has increased risk of diabetes. Thank you for watching the video. This is only an educational video about the causes of diabetes. There will be more videos soon by me regarding blood sugar values and complications of diabetes. Thank you.